to the Thought Snobs podcast. I'm Paula Swope. Let's get snobby. Today's topic is histrionic personality disorder, which is characterized by attention-seeking behaviors. Attention seekers can be challenging to handle and understand. So, when I saw this particular disorder was trending in Creator Search Insights on TikTok, I knew I had to find a qualified expert to talk about it on my podcast. And someone immediately came to mind, Chelsea Wilder. Lucky for all of us, I asked, and she agreed. If you've followed my podcast for a while, you know that I bring in experts to talk about mental health issues a lot. I do this to inform my listeners so that they approach life situations from a place of empathy and compassion versus criticism and judgment. When we're aware and informed about why people are the way they are and why they do the things they do, we're less likely to allow them to get under our skin and do and say things we regret later. Chelsea and I covered every aspect of histrionic personality disorder, and I invite you to listen and learn. You never know. The information you hear today might save or strengthen a relationship. Before you dive into this episode, I would like to clarify something that came up during my interview with Chelsea. I asked her about multiple personality disorder. She couldn't recall ever having a patient who had this type of disorder, and she wanted to do more research before she talked about it. Chelsea is very thorough and careful about what she says. After our interview, she told me that multiple personality disorder had been renamed to dissociative identity disorder. In her opinion, your personality is your personality, but some people aren't sure about their identity. So that's where that name comes from. If you enjoy the Thought Snob podcast, please remember to like, subscribe, and give it a 5-star review. So I saw histrionic personality disorder trending on TikTok, and really didn't understand why it was trending. But what caught my attention, was you had said that that was one of the worst personality disorders that a person could have. And so I was really intrigued in that moment. And that's why I asked you to come on and talk about that. And what people are going to learn is we're cousins for real.
We are.
We're first cousins, yeah. And so would you just let everybody know why you are a person that I would bring on the show to talk about something like this, and then we'll get into dissecting this personality disorder, because I cannot wait to learn about this.
Sure. Growing up, just, things happen, and sometimes, you feel like you don't really belong anywhere, and you're told to do this or be this and be this by family, friends, society, then school, work, blah, blah, blah. And so I'm always honest with, my clients. I've been in therapy myself.
And you're a mental health expert.
Yes, yes. So I have been in individual therapy myself for going on 6 years. But so when I was younger, there was just that disconnect. It's like, where do I belong? And trying to be different things, and it led to depression, anxiety, and all those things. And I do have OCD and I guess ADHD. So I had failed out of college, right out of high school, and not too good. So I was like, you know what? I'm gonna work in restaurants instead. Awesome time. But then I had my daughter. And she'll be 10 next month.
Cool.
Well, I know, it's crazy. I know.
It's crazy.
I know. So after I had her, I still took maybe about a year off. And then some, other things happened in personal life, and I was like, okay, I gotta do something else. So I started back at school. Well, before that, I reached out for a new therapist. And she's the one that I have now. She is amazing. She has helped me, and that's why I feel so confident in who I am as a clinician, because it feels natural. Her name is Holly West. I absolutely love her. She knows all about the stuff, and so I gained a lot of knowledge from her and from you. But anyway, so
Did she inspire you to go to college and end up studying what you studied?
Well, that's kind of like a funny story.
Yeah.
So, my mom, she actually, I remember it. So we were both with my daughter at her ballet practice, and I was trying to figure out what to do because I had, started from scratch. So I went back to school when I was like 24, 25, something like that.
Me too.
Right. Because didn't know what I wanted to do before. So I got my associates in arts, got my bachelor's in communication, and then I was like, I don't know what to do.
Yeah, I got mine in political science.
Yeah, it does not make sense. But I remember we were waiting there while she was in ballet. My mom was like, I think that you would like the social work program. And I was like, well, I don't really want to do social work because I don't want to go to people's houses and, determine if their kids get to stay there or not. And so she was the first one that actually explained to me that you can be a therapist with a social work degree. And I was like, all right. I still, had that imposter syndrome. It's like, I don't know if I can do that. But it's been such a natural experience. It's just been wild. Like, I don't feel like I work. I don't know how to explain it. But my mom, mentioned it to me. And then after that, it just took off. And now my therapist, she has really, I don't think I would be the kind of therapist right now, at least, without have worked with her.
Makes sense.
I mean, she has been like such an inspiration and such a safe space for me. And so having that real world example and actually living through that, I really tried to embrace that and put that into my sessions. And so I got my master's in social work, and I am a certified social worker right now, but I'm getting my license to be a licensed clinical social worker. So I've just been working, in individual therapy. Right now I'm at a private practice, but before I worked at a rehab. And that was definitely an experience, a very eye-opening experience. But I'm so appreciative of that because it really and as I study all these things, it's been interesting. Yeah.
It always is. Even
Yeah.
the bad experiences, they end up producing some kind of good when it comes to our work and relationships and everything, because it's all like one big learning experience.
Oh yeah.
So with your clients, is this something that you have encountered a lot, this HPD? Why do you think it's trending on social media?
Well, so I know, I've talked about this with my clients. I've talked about it with coworkers. I've talked about my therapist, with you a little bit. Social media, they will take something and they will run with it.
That's true.
Yeah. So I'm actually off of all social media because it was
Good for you.
just, it was just such an overload, and it's designed to keep you intrigued. It's really some other form of addiction. But with personality disorders, I know that narcissistic personality disorder has just taken off. And what I can do is go through some numbers here and through the
So we
different
can make some
personalities.
sense of this.
Yeah.
Because the reason that I really like to bring experts onto the show to talk about personality disorders and brain science is because this podcast is all about helping people feel better so they can consciously create what they want. Well, if you've got something going on that makes you feel bad, and you feel bad for an extended period of time, then you're going to attract bad.
Yeah.
And personality disorders, mental health issues, any kind of emotional struggles, trauma, it's all interconnected. All of it.
For sure.
Yeah,
Yes.
all of it. So I'm really anxious to see where this conversation takes us. So hell yeah, run with it.
Okay.
Yeah.
All right.
Yeah.
Personality disorders. Okay. Approximately 9% of adults in the U.S. have some type of personality disorder. Okay. Now, globally, it's about 6%. they have a personality disorder.
Really?
Mm-hmm.
That doesn't seem like is it a lot?
Right.
It doesn't seem like a lot.
I'll get into that.
Okay, yeah,
Oh, yeah.
okay. See, I'm already trying to analyze it.
We're going to get into meat and potatoes. All right. So, in order to be diagnosed with a personality disorder, okay, a client must meet criteria in the DSM-5. So I brought that book just to kind of show everybody. So this is the DSM-5. It's a very resourceful tool when we are needing some guidance when it comes to diagnosing and treating. So before we get into, the specific diagnostic criteria for histrionic personality
Can
disorder.
anyone buy this book?
Yeah.
Okay.
I mean, anybody can buy it.
Okay.
I think I got this one off Amazon.
Okay.
Yeah.
Okay.
But it's important to note that the 5th edition is the newest. Okay. So if you do ever want to get one.
Okay.
And they come out with new editions every so often.
Okay.
So, the main problems those diagnosed with personality disorders they face are issues with identity and sense of self. Okay, so that's a very common one amongst all the personality disorders. Issues with maintaining healthy and stable relationships. So that's a big one. And then there is often little to no insight of self-awareness and how their thoughts and behaviors are impacting their own life and those around them. So it can be a very unhealthy situation, not only for the person who might have the personality disorder, but everybody around them.
This is another reason I wanted you to come on the show and talk about this, because when you're dealing with somebody that has a personality disorder, and you aren't educated about this type of thing, and you aren't aware about this type of thing, well, of course the relationship is going to go to hell in a handbasket. Because when you're trying to manage a relationship with somebody that has a personality disorder, they're not predictable. It can cause a lot of frustration. Boundaries are crossed. So that's another reason that this is really, really important to my listeners. So I just wanted to say that. So go ahead. Yeah.
I mean, you are absolutely right.
Yeah.
If it goes unchecked, it can turn into very extreme situations.
You have to have empathy.
Yes, you do. Yes. But also have to be careful with empathy as well, because where they tend to be more dysregulated, it can be just chaotic.
Yeah.
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 So the exact root of personality disorders, not really sure. Don't really know. But so experts do say that they believe that these disorders are likely stemming from genetics, brain changes, childhood trauma, verbal abuse, parenting styles, and cultural factors. So there's a lot of different, things that can, attribute to the personality disorders. I also want to talk just super quick about the age of diagnosis, because a lot of people,
I want to know about that.
A lot of people, so I do have some younger clients on my caseload, but I work mainly with adults.
Are you talking under 18?
Yes.
Okay.
So anyone under 18 is a minor.
Yeah.
So with personalities, they're always evolving. So throughout your childhood and adolescence. So clients are not diagnosed with a personality disorder until they are 18.
Okay.
Yeah.
So okay, I didn't know that.
For sure.
Okay.
Yeah. So now there is something, it's not, a formal diagnosis or anything, but there is something called budding personality disorder. So it's not the DSM, but if we, are paying attention to different cues, if we're working with younger clients, we might be able to pick up on them possibly on their way, getting diagnosed with a full-on personality disorder when they're older. So that's that budding personality disorder. So that's just something that I like to mention because, people ask me about that. It's like, why is it not diagnosed at a younger age so we can start treatment sooner? And it's like, well, we just can't because the personality is evolving.
Right.
Yeah.
And your brain's not fully developed until you're like 25 or 26.
Right. Yes.
Yeah. Okay.
Okay. So there are 3 clusters of personality disorders. There's 10 personality disorders in total, but they're all, separated into these 3 clusters just because of how they present. So cluster A, so this involves unusual and eccentric thinking or behaviors. Okay, so there's 3 in this one. Okay, there's paranoid personality disorder. Okay. And then there's schizoid personality disorder. Okay. And then there is schizotypal personality disorder.
Never even heard of his. Okay.
Right.
Okay.
Yes. Yeah.
Okay.
So those are the ones that they're not trending
Okay.
on social media, and we just don't hear about them as much, but they are definitely a thing. And then we've got cluster B. Okay, so this involves dramatic and erratic behaviors. People with these types of conditions display intense, unstable emotions and impulsive behaviors. So this is the cluster that we usually hear about.
This is most common.
Yes, these are the ones that, people kind of jump to. It's like, oh, yeah. So you've got antisocial personality disorder, okay? You've got histrionic personality disorder. You've got borderline personality disorder and narcissistic personality disorder, okay? So we hear a lot about these 4 personality disorders, okay?
Especially narcissism.
Right, yes. And then we've got the last cluster, so that's cluster C. So avoidant personality disorder, sometimes we hear about that, dependent personality disorder, and obsessive compulsive personality disorder. So that is not to be confused with obsessive compulsive disorder, okay? Yeah, so OCD. So with obsessive compulsive personality disorder, okay, it is to the extreme. They've got to have control over absolutely everything around them.
Okay.
Yeah, so they can be, controlling of their partner, those kinds of things. So I just like to point that out as well.
Okay.
Okay, so we're talking about histrionic personality disorder today. So that's in that cluster B. Okay, so this cluster contains that personalities that we typically hear about. Borderline personality disorder, that's a big one that we hear a lot about.
Isn't that what Pete Davidson has?
I think so, possibly. I'm not
Yeah.
100% sure.
Yeah.
Okay. Yeah, so that one is, when people are mirroring somebody else,
Yeah.
or they're engaging in risky behaviors, like sex with multiple partners or addiction, gambling, those kinds of things. That's kind of, and borderline personality disorder, it's hard for them to take constructive criticism without taking it personally.
Right.
So it's personality disorders are very complex,
And they overlap.
they do.
Yeah.
Yeah, they're very, very similar.
But narcissists can't handle criticism.
No, they cannot. Yeah.
Yeah.
Yeah. So I've got, just a couple numbers here just to show or talk about, how common these diagnoses are. So antisocial personality disorder, it affects an estimated 1 to 4% of adults in the U.S. Okay. And then borderline personality disorder is actually relatively rare. Okay.
Okay.
Approximately 1.4% of adult U.S. population has that personality disorder. And then now narcissistic personality disorder, I have a couple more additional things here just to highlight that, because that's one that we hear a lot about on social media. So experts aren't sure how common this actually is. So according to research data, between 0.5% and 5% of people in the U.S. may have it. Between 50% and 75% of those cases are males. Okay. So however, many people hide their narcissistic beliefs. So that's also called covert narcissism. And so that's why it's hard to estimate, because people who have that particular disorder, there's nothing wrong.
Right.
They don't need therapy.
Right.
So it's probably severely underdiagnosed.
Yeah.
Okay. Now with histrionic personality disorder, it's also relatively rare. So researchers estimate that about 1% of people have this condition. Yeah. Histrionic personality disorder usually begins in the late teens, early 20s, and it does affect females more.
Okay, I was going to ask you that, because everything that I've seen and read says it affects women more than it does men. Okay.
Yeah. Yes, but they also think that males are probably underdiagnosed as well.
Yeah.
Because with personality disorders, with all of them, they don't think anything's wrong.
Sure.
Nothing wrong.
Right.
Yeah, so it's like, why would I?
Because they
seek
lack
support?
the self-awareness, and that's all they know. What would their point of reference be, I guess?
Right.
Yeah. Okay.
Yeah.
Yeah.
So, histrionic personality disorder. So the word histrionic means dramatic or theatrical. Okay? What do you think about that?
Well, I mean, Scarlett O'Hara is
Okay.
like the example that comes to mind. I mean, because I was trying to think of somebody that I could like that would illustrate this, and I thought about Scarlett O'Hara.
That's perfect.
Yeah,
Yeah.
like no real shallow, very self-consumed, but at the same time
Yeah.
insecure. Tell me if I'm wrong. Maybe don't even really love yourself that well,
Yeah.
right?
Yes.
Dramatic, theatrical, you're on the stage, you're performing, and
Yeah.
there's a reason, and it's all a big facade.
Yes. Yeah.
Yeah, so yeah, go ahead. Yeah.
No, I mean, that's absolutely right. So with this personality disorder, all lights and cameras and all the attention is on that person.
Spotlight.
Yes.
Okay.
Whatever they have to do.
Mm-hmm.
Whether that's dressing, you know, in a risque kind of way, or, you know, hitting on anybody, even if you're not actually sexually attracted to them. But anyway, so back to, you know, the signs and symptoms. So suicidality. Okay. It is common with personality disorders. Okay. Now with this specific one, it's to get that attention, even if you attempt to end your life or you make those gestures. So that's something that I think is important to kind of highlight.
Did you say Suicide Alley?
Suicidality.
Oh, sorry. Okay.
Oh, that's okay.
Yeah.
Yeah. Sometimes I talk a little bit too fast.
Oh, no.
Yeah. So, and also with this, you know, they can be gullible and think that relationships are actually closer than what they actually are.
Yeah.
So that romanticizing.
Right.
Yes. It's like, oh, they love me. They love me. They like really truly believe that to their core.
Right.
Yeah. And so there's all kinds of different ways that this, you know, can show up in a person. But what kind of sets this apart from the other personality disorders is the sexuality of it, and really using your body to gain that attention.
Somebody who has HPD, since they have no self-awareness, they really don't understand why they're doing the things that they do. There's definitely an underlying sadness for sure. They're seeking happiness everywhere except where they should be, which is in here. So how do they ever get any better? Like, what lands them in your office? It's like, what? Is there a rock bottom, or
Yeah.
a realization of some sort? Or, I mean, what typically do you see there?
So it's usually if like a huge life-changing event has happened, maybe like a breakup or a loss or a move or something like that. So it's that comorbidity. Okay.
Yeah.
So that is having two different, you know, diagnoses at the exact same time. So they're not, again, like you said, they don't realize that they have that personality disorder.
Right.
And so these other things start popping up. So anxiety, depression, suicidality, substance use, okay? Or like losing somebody, those things.
Gotcha.
Yeah. And so it takes a lot of, you know, asking questions and assessments and things to really get down to one of the root causes of that. And that's the personality disorder. Yeah.
Let's say that you are close to someone and you feel like they have HPD. Do you say something?
So, okay.
Maybe if they're like always seeking your counsel, but they don't take it.
Right. Okay. So with that, personality disorders, okay, there are some clinicians, a good amount, that prefer not to work with people who have personality disorders.
Really?
Yes. Because since there's no medication to directly treat personality disorders.
Oh, I did not know that.
Yeah, there's no medication
Oh
for a
my
personality
God.
disorder.
Okay.
It's just for the other things that come along with it. So that
Okay.
anxiety, depression, and things.
Right. So it's a la carte.
Yes.
Yeah, okay.
It can be challenging to treat somebody with a personality disorder. And with histrionic personality disorder, they don't like routine. And so it's hard to get them to follow the treatment plan. So it really takes a lot of patience on the clinician's side. But with this, okay, with criticism, okay, like it can be, you know, constructive and caring and all the things. With personality disorders, they take that feedback as personal, as an attack on who they are, because that is how their brain is wired. And so it's really, I've had a couple incidences where I just outright, I was like, hey, got borderline personality disorder. It didn't go too well. It didn't go too well. And of course, like, that was almost a couple years now. And so I'm learning not to actually use the diagnosis itself to say it. Now, depending on rapport and all those things, you might be able to tell a client. It's like, hey.
Right, because I would think the relationship would be a deal breaker.
Yeah.
Maybe, I don't know. Like, I know that some people are never going to take that type of news, no matter who it's coming from.
Yeah.
But I would think that they would take it. Of course, and I know varies person by person, but I feel like some people would take it a whole lot better coming from someone like you, a professional, a mental health expert, a therapist, than a family member or a friend.
Well, it just depends.
Just depends.
Because if you've got a personality disorder, it's almost like the whole world is against you. So if you've got someone in therapy, they might look at the therapist if they are not ready. So with therapy, with any kind of diagnosis, the person has got to be ready to go to therapy, or it is not going to work.
Right.
It's not going to work. With personality disorders, it's definitely not going to work if they are not open-minded and just going along with the process, because they can look at the clinician like they are high up here. It's like, oh, and you're crazy, but that's not it. But that's how it kind of sinks in. Yeah.
Because they don't process information like logically. It's more emotionally driven.
Yes.
Because everything's off balance and everything is dysregulated. And I would think that their sympathetic nervous system is probably in overdrive 24/7. And they've probably, tell me if I'm wrong, repressed so many micro traumas instead of expressing those, that their system is just dysregulated, and so they're acting like they're on the defense. They're in fight, flight, freeze all the time, no matter what. Like their body acts as though it's being threatened, even though it isn't.
You're absolutely right. So it's sad because, well, I mean, not sad, but when you have that personality disorder, you really are going around thinking that you are not worthy of unconditional love, that your self-esteem is just, it's nowhere. Your self-confidence, like, you really go around thinking that everybody hates you, and so you have to put on, I call them masks. Of course, just someone who doesn't have a personality disorder, we naturally have masks for different situations that we're in, but with personality disorders, they've got mask on mask on mask on mask, into where it's out here and you have no idea who you are in here. You've got a kind of a feeling, and I've had some clients describe it as feeling like their head is full of marbles or it's buzzing all the time, because you are just in hyperdrive all the time.
Right.
In one of those, trauma response modes. It's they're really complex, and they can be debilitating.
Can the opposite of that be true? I want to ask this before it leaves my brain. Thinking that they're not worthy, nobody loves them, but can they also have like an inflated sense of how people feel about them? Like everybody loves them when they don't. Everybody admires them when they really don't.
Yeah. So with narcissistic personality disorder, okay, with that one, they don't really care if anybody loves them or not.
That's right. Yeah.
They don't care. I don't think they focus on that. They focus on they know everything and they're right about everything.
Getting what they want out of that person.
Yes.
Yeah.
They don't really
They want people to love them because they're expecting something back.
Yes,
right.
Yes. So yeah, a narcissistic personality disorder. It's very the behavior is very manipulative, and they'll tell you. I mean, right to your face. It's like I'm just gonna use you, or they might not, but you can tell that they are. And so it's again, it's a complex personality disorder as well.
Yeah.
And that's why it takes a lot of assessments and things to diagnose somebody with any of those personality disorders.
Right.
But you are right. Narcissistic personality disorder definitely kind of stands out from the other ones because it is more selfish, if that makes sense. Okay.
They just straight up lack empathy.
Right. Yes.
And I know there are 9 traits to diagnose, right? NPD, 9 traits, and you have to have what, 6 or 7 or something of those.
I'd have to go back, but I think you're right.
I think. Well, I had Danielle Radin was on the show, and she went over all of that, and I'm just trying to remember, but I think she said there were 9 traits, and then you had to have like so many because everybody's got narcissistic traits. I mean, everybody's got that, but then it's just you cross over a threshold, and then you're considered to have the personality disorder.
Yes.
Yeah. Okay.
Yeah.
Okay.
So that's why I think that personality disorders, they kind of take off on social media because all human beings are capable of engaging in these kinds of behaviors.
Right.
But that does not mean that they automatically have that personality disorder. They have to meet that criteria. Yeah.
Do you ever have people come to you because they've diagnosed themselves?
It's usually they've diagnosed their partner. Right. Yes. It's usually they have diagnosed a loved one or someone close in their life.
Okay. Yeah.
Yeah. So it's probably, I don't think I've ever had someone, now another clinician who has, way more experience, they might have had someone come in and say, yeah, I think I got this.
Well, a narcissist isn't going to do that.
No, they're not going to do that.
They're not going to do that.
No, they're not.
Yeah. No, they're not going to watch a video about narcissism and be like, oh my God, that's me. I must do something about this now.
Right.
They're going to be like, scroll on.
But it's the same thing with the other personality disorders because they truly believe to their core that how they are is not wrong.
Right.
Because that's how they've been pretty much their whole life.
I know that this is a big question, and I'm sure there isn't a black and white answer. And I know everybody's different, and everybody is different socialization, and everybody's different. All factors considered, overarching. Are these people that are diagnosed with personality disorders, are they capable of authentic feelings for people, love, compassion?
Okay.
Are they capable of that?
Now, my personal opinion is yes. Now, narcissistic personality disorder, that might be one of the exceptions.
Yeah, I think. Yeah.
But so with my, personal and professional experience of working with these kinds of diagnoses, there are multiple clients that I absolutely adore that I've been working with. I mean, amazing people, but there's just this disconnect. But if we approach the diagnosis, through kind of different channels and implement that mindfulness and that self-awareness, and we practice those things, I do believe that they are capable of those things. But I'm more of the exception of clinicians that are like openly like, oh, I will work with personality disorders. That's okay. Because I'm naturally an empathetic person. And so, but sometimes that can get in the way. Because if you empathize too much, it can kind of make things a little bit hazy and you get lost in the chaos of your client.
Well, yeah, because they will prey on that.
Yes.
And they can spot it.
Yes.
They can really feel it and they can sense it. And can absolutely take advantage of that.
Oh, yeah.
And I found myself in situations where I didn't mean to get sucked in, but I got sucked in.
Right.
And being, empathetic turns into being more of a bleeding heart and an enabler. So, okay. Yeah. All right. This is good. I love talking about this stuff.
Yeah.
Okay.
So that's why, like, one of the key things for clinicians, and so I've had to kind of go through this, and I'm still figuring it out, what my boundaries are. So let's say like I've got someone who's got a personality disorder on my caseload, and we've been working together for a few months or a year or something like that. Um, if they are not posing a risk to themselves or somebody else, then I don't mind working with them at all. But I have to be patient and be mindful of my inner self-talk. It's like, can't push them too much, but sometimes you do have to call them out on certain behaviors that are risky. So like drinking, you know, with these personality disorders, they're at a higher risk of developing, a substance use disorder or, alcoholism, those kinds of things. If we try to address those kinds of behaviors and I'm not seeing any progress or anything, I will refer those higher risk clients to maybe like an IOP. So that's an intensive outpatient treatment, where they go usually like maybe 3 days a week to like 4 or 5 hour long therapy sessions, individual, group, and they usually have that medication on site and all the things. So it kind of just depends on knowing yourself as well. And so now for me, I've learned so much about myself working with all kinds of different diagnoses,
Oh my
including personality
God,
disorder.
I'm sure.
Yeah. Oh yeah.
I'm sure.
Yeah. And so I tend to be, a little bit more lenient with clients who exhibit those kinds of behaviors.
I don't judge that. I'm
Yeah.
not judgy when
Right.
yeah.
Yeah. Yeah.
When it comes to things like that. I
Mhm.
get it.
Yeah. Like if you're judging somebody with a personality disorder, that's doing them a disservice.
Exactly.
And it's just feeding the personality disorder.
Yes.
It's feeding that isolation and all things. And
Yes.
one of the main things I have found, working in individual therapy is people just want to be seen
Yeah.
and they want to be heard.
Mm-hmm.
And that is personality disorder right there.
Mm-hmm.
So if you are able to give them that space and, make it as judgment free as possible, start feeling comfortable, and then it just takes a little bit longer.
Sure.
Just being honest, it just takes a little bit longer. But once you build that relationship and everything, start diving into more of the deeper things. And a lot of time with personality disorders, trauma is at the absolute root of it.
Absolutely.
Yes.
Absolutely.
Yes. And there's a lot of fear that they'll be judged or be labeled as crazy and maybe like kicked out of the practice
Right.
if they share about those things. So yeah, it just takes patience. And now I have had clients when I try to, address some more serious things, they don't like that.
Right.
They don't like it. Sometimes they come back and sometimes they don't. I've had more clients come back than actually not come back.
Right.
And again, it just boils down to that time and patience.
And wanting to feel better.
Right. Yes. And that's why I remind all my clients, it's like therapy is only going to work if you want to be there.
Right.
That is like key ingredient right there on the client's part, if they want to be there. Now, if they are there, court ordered, or they feel like their family's worried about them, or they've been told, hey, you need to go, it's not gonna do any good.
Right.
It's not gonna be doing good. So like if you're a clinician out there, and again, take everything I say with a grain of salt, because coming through my personal experience and things. But if you're a clinician out there and you've got a new client and they're telling you or starting off saying, well, I'm here because such and such said I need to be here, I'd be a little more hesitant to mention a personality disorder, because that's pretty much gonna say, here, it's the door. So it's just it's complex.
It takes a lot of intuition too, I would think.
Yes. So that empathy really helps. Just as in therapy in general, and I'm sure like what you do as well, like,
Oh yeah.
it's really needed.
Yeah, because I have to create a space for people where they are comfortable enough to tell me the truth. You have to tell me everything.
Right.
You don't have to tell me, everything, but I got to have something to work with. And that's why I tell my personal stories a lot and with the work that I do, because it's relatable. And when people see that, yeah, just because you are in this position to help, it doesn't mean it's a hierarchy. It doesn't mean I'm up here
Right.
and they're down here. We're on equal playing ground. I learn from them too, just
Right.
like you said.
Mm-hmm.
They've got their skill sets. I've got mine,
Mm-hmm.
and I just happen to be in a position where I'm the person that might be able to help them.
Mm-hmm.
So the number one thing that I have to do is I have to relate to them, and the one way that I do that is letting them know, hey, I've probably been there in some way, one way or another. And if I haven't been, I get it. I've probably been in a similar situation. It's like I am not sitting here from a place of perfection. I'm very human,
Yeah.
you know.
Yes.
So where does, I want to ask this before I forget again, because this is fascinating. Where does multiple personality disorder fit in? Does it fit in any of these clusters?
So it's not in this cluster, and that is another complex one because it doesn't mean that you have all kinds of different personalities. It's just another way to, I guess, describe that certain disorder. I don't know enough to state like facts about it.
Sure.
But I do know that it doesn't mean that that person has all kinds of different personalities. It's just kind of basically what we've been talking about, that feeling disconnected from who they are and not knowing it.
Right.
Yeah. So that one, I don't have like a lot of facts on that one, unfortunately.
Yeah. No, that's fine. I just I think about that a whole lot because I knew someone as a child and then on into my teenage years, and a psychiatrist told their family when this person was pretty young that they suspected that this person had multiple personality disorder.
Okay.
And as they got older, there were clearly some serious problems going on there, dangerous actually. But this person took on all kinds of different personalities. Like the first time that they watched the movie Scarface with Al Pacino, that became a personality.
Okay.
When Dr. Dre and Snoop Dogg dropped the Chronic back in the 90s, they took on those personalities to the extreme.
Okay. Yeah.
To the point that it changed their whole identity and their whole life and the trajectory of their life. Okay. And we all sit back and watch this. And to this day, I do not, this person is not diagnosed or treated or anything. They've been in and out of prison for 30 years.
So that borderline personality disorder, that mirroring, you take on, so like, let's say like you have somebody and they become somebody else in different, friendships or relationships. Like that's where you can get, that codependency.
Single white female.
Yeah.
Okay.
Yes.
Okay.
So you kind of mold yourself to whoever you're talking to in that moment. So that's what borderline personality disorder is. Another one that it's very difficult. It's very challenging to treat because that person actually takes on the identity of who they're talking to. And so that's, I think, where a lot of people probably get that multiple personality disorder kind of like mix up, but it's usually borderline. And that's one of the ones that we talk about a lot. And that one, it comes with, risky behavior, the suicidality, all those kinds of different things. But they really do take on the identity of whoever they're around. Yeah.
Wow.
Yes. It's very dysregulating. It's like, I don't even know who I am.
Right.
That's what we see a lot of with this stuff. Yeah.
So have you ever seen anyone rehabilitate? I mean, is there a cure? I mean, you said there's no medication.
There's no cure.
Okay.
Yeah. So, I mean, once that personality disorder has been triggered in your system. And again, it can be sparked by trauma, or just those genetics, those kinds of things. It's kind of like when you become addicted to something. It's there.
Right.
That addiction is there lifelong.
Mm-hmm.
But with any diagnosis, the hope that we have is the choice that we get to make, whether or not we want to treat it or not. So once we know something, once we are diagnosed with something, you know it.
Right.
And so it's your responsibility, it's the client's responsibility, or it's my responsibility, yours, his, whoever's, to treat those diagnoses. So let's say like I'm diagnosing you with a personality disorder, these things. It just depends on how much self-awareness you are willing to practice and mindfulness, because those are the main treatment options. There's cognitive behavioral therapy, CBT. That's I use that very frequently in my therapy. So basically, really diving in and paying attention to what your inner self-talk is and challenging those things. So really being aware of it. And I always tell people, especially in the beginning of therapy, it's very emotionally taxing.
Mm-hmm.
It's very, very hard.
Yeah.
Therapy is not for everybody.
Right.
Because it is so hard.
Right.
So, I think that we're kind of coming out of that stigma of, people that go to therapy are wimps, or they're crazy, or whatever.
Yeah, those are the strong people.
Right. Yes. To work through this stuff,
It's hard.
it's very, very, very hard.
And you have to be dedicated.
Yes.
Mm-hmm.
So yeah, CBT is a great way to, kind of target certain things. Then there's DBT, so Dialectical Behavioral Therapy.
Okay, I don't know about that one.
Okay, so that is, it's kind of rooted from CBT, but DBT is more focused on mindfulness.
Okay.
So basically what that says is that you've got two things. Both of them are absolutely true, but they are completely opposite of each other. So it's like, I hate myself, but I want to love myself too.
Mm-hmm.
They're both true.
Mm-hmm.
Now, that causes dysregulation.
Mm-hmm.
Because you're like, oh my goodness, both of these, I don't know. And so the main goal of DBT is to find the balance, that sweet spot in the middle. It takes validating all of the negative thoughts, feelings, emotions, all of them, up to all the good ones. And so that's why in the beginning, we stay dysregulated more, because we're going back to back, and it's confusing talking about all this, because it's like, okay, I'm getting all this information that now I've got this diagnosis and this. But yeah, DBT, that basically is what that is. It's rooted in mindfulness. And so now if I have somebody on my caseload who is more extreme with their personality disorder, DBT is go-to. So we will refer them to a specialist who uses DBT, pretty much all the time in their individual and group therapy. And you can get that in those IOPs, or just going to a different therapist. But if the person is open to actually wanting to change, because this is another thing that I tell all my clients. I picked this up when I worked at the rehab, okay? That was a really good experience for me. It helped me mature, but I use this now in my individual sessions. I tell people, I'm like, hey, you can come in here and you can bullshit me all day, but you can only bullshit yourself so much, and that's why you're here. So as long as you are being honest with yourself, this is going to work. And all the rest, it'll start coming out in the sessions.
Right.
So that's really like the only thing that I ask of my clients. It's like, if you're being honest with yourself, this is going to work. Now, the people that come in and they're not there yet, that's the people that you'll see that they don't come back. And I always, sometimes I think about them. It's like, I hope that, later on they do come back. If it's not working with me, somebody.
Right.
Because there's stuff going on. I forgot your question, because I kind of went off on something there, but
I totally got another one, and I don't remember it either.
We're cousins again.
Yeah. I don't even remember. But I've got another one. How important do you think it is for somebody to revisit really, really painful past experiences?
Okay. It is okay.
I don't push that.
Okay. So the way that and this is where my own personal therapy kind of comes into play, because my therapist, Holly, I told her I say hi.
Is she in Lexington?
She is actually based out of Frankfurt.
Okay.
So, yeah, with my own personal therapy experience, my therapist she's given me the time and the space that I have needed to feel comfortable about talking about this stuff. And so that is what I do. That is a priority of mine in my sessions. And I even tell people in their intake, I'm never going to push you to talk about something if you are not ready for it. But I also tell them talking about these things is so incredibly important. But it has to be on your own natural timeline.
Right.
Because I've got some people that come in and they're like, we don't got to talk about my childhood, do we? And I'm like, well yeah, at some point.
Right.
But when you're ready. Now, if they do start, talking about things, I might ask a question here and there. But really giving anybody with any diagnosis that time and that space to feel seen and heard does absolute wonders. And that's why I always talk therapy is it can't be replaced.
Right. I agree.
Just talking to
Just
somebody.
talking about it, yeah.
Yes, and that's one of the main things to help treat personality disorders.
Right.
It's just talking. On top of the CBT and the DBT and those kinds of things. So yeah.
Yeah. Okay. Yeah, and I think that is I think that's a really, really good way to approach it too, because typically, like I said, I'm not going to push anybody to do it, but if I do my job well, then they're going to end up feeling comfortable enough to talk about it. And talk therapy cannot be replaced.
No.
It can't. And when you talk about something, things come to you. You realize things, and you grow your awareness around that. Yeah. It's this is all absolutely fascinating.
Well, I'll also touch on so the reason why it's so important to talk about traumatic memories and experiences is because, especially with personality disorders, we take those experiences on as our identity, and we walk through life thinking everybody can see everything. We are projecting those experiences on absolutely everything, and all that does, suppressing those emotions and things, well, first it causes memory loss, emotional dysregulation, big time. So if we're going through life like that with the burden just all over us, we're absolutely miserable, and it's all guilt and shame and suffering.
Oh, it manifests into, I mean, it causes a lot of inflammation in the body. And inflammation is, I say this all the time, at nearly the root cause of every disease known to man. And memory loss is a big one.
Yeah.
And it will eventually manifest into all types of physical sicknesses. Absolutely. There's science to back it. I mean, there's science to back that up. And when a person doesn't want, if I can just instinctively kind of feel that talking through what maybe they really need to talk through, if that's not going to work, for them in that moment, then I'll kind of switch it. Because I'm a life coach. I have, no medical background. I'll switch it to something that I know will help them release stress and alleviate inflammation in their body. And that works wonders. I mean, the breath work, oh my God, the breath work is like,
oh, amazing.
Incredible. Game changing shit.
It is.
It is,
guys.
It is. Like miracle shit. It will unblock, energy, emotional blockages, energy channels. It will bring you clarity. It's like everything.
Yes.
And a lot of people, some people just don't like to meditate, or they can't meditate.
It's hard.
It can be hard for a lot of people. So the breath work, though,
Mhm.
that's the go-to. Like if
Yes.
somebody says, I cannot meditate, then
Mhm.
you know, well, let's try this breath work here, and that
Yes.
usually works.
Yeah.
So yeah, I just wondered how you approached that situation in your work, because it
Mhm.
always comes up.
Yeah. Okay. So again, it kind of boils down to how invested the client is to actually wanting to feel
Wanting to
better.
feel better.
That's a
Get
big
rid of all
thing.
that.
Yes, because
Yeah.
we can talk about the coping skills, and that plants that seed.
Yeah.
Our brains, we can use that.
Yeah.
Because our brains are so
Oh my
powerful.
God.
But if we are fighting against it all the time, and we're not using those coping skills outside of therapy, it's not going to help
Right.
really much at all.
Right.
And so I try to sometimes we'll practice the breath work in sessions. Now on your live a few weeks ago, you did the eye tapping to target the vagus nerve.
Yeah.
That has been absolutely amazing, because I didn't know about that before, but that is my go-to now.
Here's another one. Tug there and in the middle. Well, for our people who are listening, not watching, tug on your earlobes, and then tug in the middle of your ear, and then tug at the top, and then go back down to the middle, and then tug right there.
Okay.
And that stimulates the vagus nerve. But the eye, oh yeah, the eye exercises.
It's amazing.
It's incredible.
Well, and the reason why I love that one is because I think it's so relatable. Because when people are stressed or you're upset, we grab our face. It's
Exactly.
like, oh my gosh.
Right.
And so now, some people, a lot, when I bring that up, they're like, I'm gonna look like a crazy person. I'm like, so you feel better after?
Nobody cares anyway.
No.
People really don't care.
Nobody cares.
No.
They just, the human experience. So with personality disorders, people are quick to judge.
Yeah.
But it's like, we're all capable of experiencing all of those symptoms and those behaviors and all the things. It's just more extreme, I guess, with personality disorders. But yeah, with those coping skills, with any diagnosis, they don't work if you don't practice them.
Right.
So with talk therapy, we do that, and we explore the negative inner self-talk.
Yeah.
That is why talk therapy is so lovely, because sometimes we get in these experiences, these situations that might be similar to something that we've experienced in the past, and our thoughts start running first, and that triggers that central nervous system.
Yeah.
Or the central nervous system can be triggered first, and that causes the thoughts to spiral.
Right.
So that's why you have to come at it in multiple different directions to target different things in different ways. And that's where that breath work, oh my goodness, it is a life changer.
It is, because it helps with mindfulness. And I know that in our last few minutes we were going to talk about, you were going to switch over to talking about mindfulness.
Yes.
And we were going to talk about medical cannabis, right?
Yes.
Yeah.
Yes. So now with personality disorders, where that higher risk is of developing, an addiction or something like that, with medical cannabis, it's very important that if you do decide to go and get your medical marijuana card, that you disclose all of your diagnoses to that prescriber, because there could be some negative side effects of, or potential of developing an addiction. If it's not with that marijuana, it could be something else. But so with mindfulness, that is the outside of talk therapy, mindfulness is the biggest advocate, I guess you could say, of personality disorders. Now medical cannabis, it can help heighten our senses, and we're paying more attention to that mindfulness. So like the breath work. Now, of course, you need to talk to the prescriber for different details of different strains that can be helpful for that. But different strains can actually help calm the central nervous system and kind of give you that wiggle room. It's kind of like medications.
Yeah.
Medications, how I kind of describe them to clients that I have is they'll meet you halfway. about 50%, okay? So they give you this little bit of wiggle room of clarity to where that mindfulness and stuff can actually go into action. And so medical cannabis can do the same thing depending on the individual. Now, it might work for some people and it might not.
Right.
But I did want to kind of talk about it just really quickly.
Yeah.
Because it just became legal in Kentucky.
Yeah, that's why I wanted you to talk about it.
Yes, yes. So as of January 1st of this year, people who meet certain criteria can get their medical marijuana card. So recently I became an affiliate with Bluegrass Canamed. They are absolutely wonderful people.
They sound like it. Yeah.
Yes, they. So Crystal Kelmanson, she is a nurse practitioner. She's got an office in Louisville and in Lexington. She witnessed how opioid addiction, can absolutely ruin somebody's life.
Yeah.
Yes. And so I actually went to their office, Bluegrass Canamed, to get my own medical cannabis card. And that's how I kind of became an affiliate, because we both shared that same passion for, just letting people have different resources to feeling better.
Right.
So yes, Crystal Kelmanson, she, if you do end up going, your listeners, if they do go to see Crystal, ask her all the questions that you have, because I know a lot of people in Kentucky, they're kind of hesitant to kind of jump on this train of cannabis.
This is way progressive for Kentucky.
Oh yeah,
It's something that should have been done a long time ago.
Yes, yeah.
If anything, for revenue, I'm sorry, this is a poor state and it doesn't have to be.
I agree.
I agree. Come on.
Yes.
Yeah.
It's
I mean, we sell alcohol.
I know.
Like it's going out of fucking style.
I know.
Serious? Come on.
I know. Me and Crystal were talking about it's kind of crazy how you need a card to get marijuana, but you don't need a prescription card to get alcohol.
No.
You know what I mean? So it's kind of crazy.
Yeah.
But alcohol is one of the worst things.
Mm-hmm.
It's one of the absolute worst things, especially if you have a personality disorder, because you use that to cope with everything,
right,
to hide everything, because you are going around feeling like you have to hide your true self.
Yeah.
But
it's self-medicated. I mean, there's no doubt.
Yeah, it's not good. So
no.
So cannabis can be a good alternative, but it depends on your body.
Right.
Some people could develop an addiction to it.
Right.
Some people might not.
Some people might not.
So with Crystal, they are, like I said, they have an office in Louisville and in Lexington. If you go to their website, so bluegrasscanamed.com, I'm actually going to walk you guys through their website.
Okay.
So you go there.
And we'll put this information, of course, with the
the
episode too.
Sure.
Yeah.
Okay. So on here, your first visit, so that intake is $180. That's actually a little bit less than some other offices that when I was doing my research. So when you go on there, you can see there's 4 different boxes here. So the first one is you can check your eligibility. Second one is you schedule that appointment. And then the third one is accepted documents to prove that you have certain diagnoses. And then the fourth is you submit the application for your card. So let's say like you go on there and you schedule your appointment, okay? So you put your name, your email, and your information. Now, if you are finding out about Bluegrass Canamed through this podcast, if you put Thought Snob Podcast in that little box that says referred by, and in the promotion code, you will get $10 off of your first visit with Crystal. And also, if you want to put my referral code on there, it's CW66. Then they will know, for sure of where you guys.
Good.
Yeah.
Okay, good.
But yeah, you will get $10 off of your. Sorry, I'm clapping a little bit. $10 off of that visit. But yeah, if you do decide to go there, take all the questions with you, because she will take time, and I believe that she has hired on a couple more people to her staff. They will take the time to answer your questions, because it is new, and it is, we hear, that marijuana is a gateway drug, and it can be for certain people.
Right.
Sure.
Let's
be honest here.
Anything can be.
Right.
Really, I think.
Yes. Yeah. But take all your questions to them. Anything that you, are hesitant about or you're scared about, different rights I know, have people been worrying about, that they will take the time and talk with you and help you feel more comfortable about everything.
Okay.
Yeah.
Yeah, that's good to know. That's a great resource.
Yeah. I mean, I'm so excited.
Thank you for bringing it.
Yes, I'm so excited for it to be accessible, in Kentucky, because like you said,
Yeah.
not only is it helpful for, just physical health issues, mental health stuff, but for revenue.
Oh,
I mean,
yeah.
I think it's going to be great. It's just people, trying to get used to it, embracing it.
Right.
Yeah.
Right. Okay.
Yeah.
All right. Well, I'm going to tell you. I think you need to be a professor.
You do?
I really do. I swear, I really do. Like, this has been fantastic, and you're the perfect person to be in the line of work that you're in. And yeah, I mean, I know you real well. I've known you for a really long time.
Pretty long.
But you've just got a natural ability to make people feel comfortable. And, you can tell you anything, and you're very, very understanding and fair. And you look at it, from a lot of different angles. And the knowledge that you brought on to the show is just freaking invaluable. I mean, like, this has been great. This is going to help a whole lot of people, I think, just increase their own awareness and knowledge base about personality disorders and how to handle and manage relationships healthily with people that maybe they know have a personality disorder or maybe suspect.
Yes. And, so I was going to mention.
Oh, yeah, go for it.
You have been a mentor to me. I mean, she's great. All right. But you and I are very similar.
We are. Yeah, we are.
I swear I've had people come in. So, like, at the office I work, we've got our pictures on there, and people can read our bios. People come in, they're like, and we do the intake, and they're like, you know what? I was a little surprised that you were, able to talk about all this stuff because you look so young. And I even said, wait, when I go, well, let's schedule your follow-up. They're like, wait, you're the therapist? I'm like, well, yeah. Yeah. I mean, like, again, like, just giving people a space to feel safe and seen and just be a human about it. Because we're all humans here.
We're all after the same thing.
Right.
Everybody's after the same thing. I've never heard anybody say, I want to be sick and unhappy.
Right.
I mean, that's not what you...
Right.
And if they say that, that's a whole other thing.
Yeah.
But everybody's after the same thing. People just want to feel better, and in order to be happy, they got to feel better. And it's like, if therapy is going to get you there, then great. If life coaching is going to get you there, then great. Whatever to get you there, just do it.
Yes.
Just do it.
Yeah.
You never regret it.
I tell my clients, I'm like, listen, if I'm not the right clinician for you, or if you feel like we are not getting anywhere, it's not going to hurt my feelings if you put in a request to transfer or whatever. Do what works best for you, but as long as you are being honest with yourself.
Right.
So, like, if they do want to transfer, but it's because I'm challenging them on some of these more difficult topics, it's like, well, gosh, are we ready though? And you take a break.
Right.
But doing what helps you most. There's no right or wrong answer. And that's it. I agree with you. Yeah.
And I'll tell you this real quick before we officially close out. You want to hear about how my very first therapy appointment went ever?
Yes.
So I took myself. I was 26. I was 26 or 27. And I went to see this lady, and she came highly recommended from a friend of mine. And she was in Lexington, and I went to see her. And I left, because she had a practice in her house. And I left her house that day, mad as hell, bawling, because she told me I was immature.
That's kind of rude to say. That's okay. All right.
I was like, fucking immature? No, I am not. Well, I was, zero emotional intelligence. I mean, zero mindful awareness. I mean, zero. Like, I was in there in victim mode. I was like, they've done this, and they've done this, and they've done this, and they've done this. And I never mentioned a damn thing that I had done, but I had been a willing participant with all of these people that I was labeling as assholes and abusive and, you know, all this stuff that I was saying. And she gave me Mother Teresa's prayer. I was like, okay. And I was reading and I was like, what? And I don't remember exactly what it said, but it went a little something like this. Kind of, you don't really, like, you're not like the most special person in the world. The world does not revolve around me. I mean, it was just like this list of things, you know?
Yeah.
And I read that and she's like, you need to read this like every day, Paula. Like, you need to maybe even put it under your pillow. And you need to read this, because what I'm seeing right now is like your number one problem is you're very, very immature. I was like, I was shit-canned hammered within an hour, because it took me 26 minutes, just about it, roughly, to get from her house back to Richmond, round up my crew, and get to the bar. Okay. But can you believe this bitch said that I was immature? Well, I can only imagine what everybody was thinking. They're probably like, yeah,
Oh,
well.
She just said it flat out.
Flat out.
Okay.
First,
On
first
the first
round.
meeting.
First round.
Okay.
First round.
Now, sometimes that approach can help people.
It did, though.
Right.
But it did. And I
Yeah.
went back, cussing her all the way across Clays Ferry Bridge. Like, this bitch gonna tell me something bad. I swear to God, I'm gonna go off on this.
Yeah.
And I get in there with her, and I'm never hateful or mean to her. I was just talking shit, you know. But I saw her a few times and realized that she really wasn't the person for me, but she really was the person that really got me on, you know, the path to admitting.
Sure. Yeah.
Yeah.
Well,
because I would have never thought I was immature.
yeah.
And I was terrible. I was the most immature person ever.
Well, I mean, so like now me personally, I don't know if I could tell a client, be like, hey, you're immature. Because, you know, and again, like with personality disorders, if you say that to somebody who's not ready to hear it, they won't come back.
Right.
But some people need to hear those straightforward kind of words.
Yeah, I did.
Yeah,
I did.
And it can go one of the two ways of just being, oh, I'm never going back, or it can actually lead to where you are right now. So like with my therapist, hey Holly, she one day, I remember this, and I talk about this often in my sessions with my clients. She said, there's victim mode and there's champion mode. She said, Chelsea, you keep choosing to be in that victim mode.
I did for a long time.
Yeah. And you take it, you're like, you don't know everything about me. How could you say that?
Yeah, I know.
But it's the truth. And it sounds like you and we knew that was the truth. And so that's what kept us either going back or exploring, you know, other options and just working on ourselves. It's like accepting the truth about it.
Yeah, I had to admit it. And I didn't want to, because it was like a security blanket. It's like I could hide behind that shit. Like, I could blame everybody for doing me so bad. That's why I hadn't progressed. That's why I hadn't done what I knew what I wasn't self-reliant. I wasn't as far ahead in life as I wanted to be. I was hiding behind that.
Yeah.
Like, seriously. I mean, that was my deal back, you know, back then. And her telling me that I was immature, it really started me thinking. And I didn't like it. I wasn't prepared for that, because I thought that the therapist was just supposed to be my cheerleader. Like, she was just going to sit there and agree with everything I said. I mean, that's what I thought therapy was.
Yeah.
That's not the case. So I was just really uneducated, inexperienced, and just thrown for a loop. Just thrown for an absolute loop over the whole thing.
Yeah.
And but I needed that, and I did go back and work through some, a lot of stuff with her. But my first therapy appointment, yeah, man, that was a hoot. Like I still laugh about it to this day.
But see, like that right there, what you said earlier, like why is it important to talk about, traumatic experiences and things? It helps us feel better.
Yeah.
You hear that, people say like forgiving your abuser, things like that. Now, I have used that verbiage in my sessions, and some people don't like that forgive them. And so I've reworded it to say, instead of accepting what happened, because what happened.
Right. Can't change it.
It's accepting it from a place of love and freedom versus hate and resentment and all those different things. Because it's like that old saying, giving somebody a shot of poison, expecting them to drink it, but you're drinking it.
Right.
Like that's what that is. And so talking about those experiences and coming to the conclusion that those things did happen. Sadly, some of those things do happen. But also knowing that those experiences don't define you.
No.
They don't have.
Things aren't the same now as they were.
Exactly.
Yeah, in the past.
They don't have to dictate your future unless you want them.
Unless you want them to.
Yes.
Yeah.
Yeah.
Well, we have just absolutely killed it.
I think
We are on show.
The Thought Snob podcast with Paula Swope has been brought to you by Thought Snob Media in association with Special Purpose Studios. All production, mixing, and sound engineering by me, Will Swope. We hope you've enjoyed this podcast. Please take a few seconds to give us 5 stars and leave a review. See you on the next Thought Snob podcast with Paula Swope.